To document the review of systems using the checklist in one of our standard progress note templates, click the Open icon. You will then see a list of systems that are typically noted when reviewing the patient's history. As a general rule with all of our checklists, the minus sign would be clicked to document the normal findings for that system, and the plus sign would be clicked to document the abnormal findings. You will have the option to manually click off the systems you want to document, or if the findings are generally normal, you could click the N All Normals icon at the top of this dialog to quickly notate that. When you do so, all minus signs will become selected, or green, and the normal statement configured for that system will be documented. If you did not cover a system, or just don't want anything printed for a particular system, undo that action by clicking the green minus sign next to that system. This will remove all the text for that system from your chart note. If you would like to modify one of the standard statements, right-click on the system title from the top of this dialog. Then click the Edit statement, which will then open a free text dialog with the standard text we had previously seen output in our note available to edit. Make your changes and click OK. The changes that you make by editing a statement will only be displayed in this note. Editing a statement is not modifying the defaulted text for a template. To document abnormalities for a system, click the plus sign associated with it. This will then prompt you to select from one of two statement options. The one you select is completely up to your preference, and the only difference between them is that the second option will allow you to document both positive and negative findings, whereas the first statement option only allows you to document positive findings. Click the desired statement so that you see a black box appear to the left of it, and then click OK, which is located on the right side of the pop-up. This will display a follow-up question dialog in which you have the chance to click off symptoms that the patient may report. This is a multi-select field, so click as many as are appropriate. If you don't see the option you are looking for, don't worry. Click OK when you are done. Then right-click the statement and select Edit. This will allow you to type or dictate the additional necessary information. Click OK when you are done, and you will see the changes reflected in your note. If you would like to free text or dictate more information, use the free text box at the bottom to do so. The text entered in the free text box will show as a separate paragraph when printed. Click OK when you are done documenting review of system information, and you will see your text populate the chart note. Similar to the All Normals quick link within the checklist, please be aware that you can select all normal statements without even accessing the checklist dialog by clicking the N located in the menu bar of the checklist. Upon follow-up, if the patient's review of systems information hasn't changed since their last visit, click the blue arrow located in the checklist menu bar to carry this information forward. When you do so, you will be presented with a dialog listing the most recent chart notes to select from. Select the note in which you would like to pull the review of systems information from, and click OK. The text from the previous note, including any free text entered within the checklist, will then output in your current note. If you need to modify any of this text, click the Open icon to do so. Then follow the steps we discussed earlier on how to modify an individual statement. If you did not select the Carry Forward option prior to opening this dialog, you will have the option to do so within the dialog by clicking Carry Forward from the top. Or if you would simply just like to start from scratch, you could click Clear All to remove all pre-existing text and start over.